COVID update for today. In Itasca County, our cumulative cases are at 9,720. With the report that I provided to the board, I don't know if the highlighted areas are showing up at all, but there's a couple of pieces to our data that is affecting our cumulative and our daily numbers. There's quite a bit of over-the-counter rapid testing occurring right now, and there isn't a mechanism to report those to the Minnesota Department of Health. And so if you're testing at home and not having it confirmed at like a clinic or a hospital or one of those other settings, it just doesn't reflect in our numbers. And so our COVID cases are actually probably higher than we're indicating right now. And even with this, we're pretty high. We're actually the highest this week, again, that we've been in the entire pandemic, surpassing where we were in November. I also want to say there's some pieces with the school data. They are reporting to the Minnesota Department of Health, but for whatever reason, those don't get into the numbers as well. And so cases that are identified in the school setting also aren't necessarily reflected. But the last 7 days, we've still had 299 cases added to our database, 657 in the last 14 days, and our 14-day case rate is 144.3. And again, highest we've had the entire pandemic. Deaths were at 127. That is 7 more than the last time I was here 2 weeks ago. Our vaccines, we have 25,057 Itasca residents who have completed their series. That's 61.8% of our 5 and older. And then our entire population, regardless of age, is 58.5%. For public health vaccine clinics, we are scheduled every week through the month of February, and we'll just keep reevaluating after that. We're rotating our offerings of Moderna and Johnson & Johnson just every other week. And I would say for anyone listening, we have some extra vaccines available today, this afternoon of Moderna, if anybody would like a booster or dose 1 or 2. And those are offered at the Itasca Resource Center. Booster recommendations have shifted a little bit in the last few weeks. Anyone 12 and older who are 5 months after completing their primary series of either Pfizer or Moderna, or you're 18 and older and at least 2 months following your Johnson & Johnson series, you're recommended to receive a booster. You are able to mix and match your vaccines after the primary series if you like. So for example, if I had Moderna first, I could get Pfizer later. Of course, if you're under 18, Pfizer is the only one available for you. We continue to have our clinics and our pharmacies offering vaccinations for weekend appointments. Walmart is taking weekend appointments for sure. I believe Walgreens might as well. So there are options if you have a schedule that needs to have that happen, or if, for example, you want to receive it on a Friday or Saturday and have Sunday to recover. Those are options available to the public. Omicron, it can be pronounced either ways. It's the active variant in Minnesota. Our data is still showing strongly that vaccines are effective against the variant in preventing the severe illness, hospitalization, and death. Schools, we're still working with them weekly. They have varying levels of mitigation strategies. Most of that includes masking in certain buildings or classrooms for certain periods of time when they're seeing increases. Thus far, Itasca schools haven't had to move to a distance learning model. They would prefer that be a very, very last resort if they can help it. Again, Project Blue Light, we discussed with the previous agenda item, asking folks to light up your business or home with the blue lights. If you want a blue light bulb, Elder Circle has them available. You can call them because they're not fully in person, so you could call them and access that if you'd like. Vaccine breakthrough, again, this is getting a little tougher because, again, the at-home tests aren't reflected. Of the ones that we do have, 6% of our fully vaccinated have tested positive. Again, I feel like this is higher. Don't know how much it's higher. But what is still reflective is of our 25,057 fully vaccinated Itascans, We do have the hospitalizations and the deaths post-vaccination, and those would be tests that would be verified most likely by a clinic or hospital and would be in the data. So of those 25,000 plus people, 95 were hospitalized and 17 died from COVID. Hospitals this week in our area, the past 2 weeks, as our county numbers go up, so do their staff testing positive, and so they've just had a tougher time staffing in the last couple weeks, and they're hoping to see this turn around in the next week or so. I am getting updates, particularly from Grand Itasca, and their positivity rate's it's the highest it's been actually, so. Again, masking in indoor public spaces is recommended. There is an initiative starting this week. It's a federal initiative getting N95s out to folks who maybe can't access them on their own. Public health will be a part of that distribution. We don't have it entirely planned out yet. We're waiting for these to arrive. Can't necessarily be used for our own organization. They are for the public. They're for people that don't have access. And so we'll be working with some of our partners, Second Harvest, probably Project Care, Kiesler, a few of those, probably our Head Start. We worked with them on some testing initiatives, so we'll work with them again. And then some pharmacies will have them available as well. So we're waiting to get a list on who will have N95s available for distribution. One change that we're doing, we're decreasing the amount of time our call line will be answered from 9 to 1 Monday through Friday. And this is solely due to staffing, and most of our calls actually come in the morning anyways. It's rare at the end of the day that we're receiving a lot of calls. So just for staffing purposes and being able to maintain that, because it's still valuable and people still do call us. We're just shortening the hours each day.